Hi guys, so I have a few minutes today and I wanted to share with you my 9 months post-op from having VSG, bariatric surgery. Do a little check-in with you guys and let you know how I've been doing. I will just say overall I'm doing really good. I'm feeling really good, but I do have some things to discuss. So without further ado, as far as stats, I have lost 13 pounds in the past 30 days. So I did really good this month. It was a weird month because I didn't lose much in the first 2 weeks. And then the last 2 weeks of this month is when I basically lost all of it, like 10 of those pounds. So, you know, those kinds of things happen. Where you'll go a long stretch without losing much, even if you're doing all the right things. And then out of the blue, like I didn't change up anything and I lost, you know, that much weight. So it's not always consistent. Like there are spurts of loss and then some stabilization and then loss. And it's always just that way. So I have my notes here. I am down 134.2 pounds since the surgery. I was not one of those people who lost weight during the liquid diet before surgery. I did do the liquid diet. For the most part, it was a 2-week liquid diet before surgery. I did better the second week than I did the first week, but I did not lose any weight on that. So, all of my 134.2 pounds have been lost since my surgery date, which I know is rare because I look at a lot of other people's stats in the groups, like the VSG groups and things like that, and a lot of them lost a significant amount of weight before surgery. I was not one of those people. The big thing I left out last month that I just didn't talk about, I don't know, it kind of left my brain last month, but I did get some labs drawn at the beginning of March, end of February. So I would have been 6 months post-op, almost 7 months post-op. And, you know, we routinely have to get those labs drawn just to make sure that we are healthy and thriving and doing okay and taking our vitamins and all of those good things just to make sure you're healthy. And I had some things come back this time that were low and a little bit of concern. And so I'm going to share with those things with you. Now, if you have similar stats, you know, I'm going to tell you what my doctor told me to do about it. But please follow your own doctor's guidelines and recommendations. I was shocked about this because my first set of labs, I think at 3 months post-op, I was like totally doing fine still. But yeah, so here we go. My prealbumin was low at 15. The normal range was from 17 to 34. And I had never heard of prealbumin, but they check me for everything, like every kind of vitamin level and everything they check. So I think this has to do with protein. And I looked up what low prealbumin, I think that's how it's pronounced. I looked up what that means, and it is a sign of malnutrition. So that was like a little bit shocking because I definitely eat, and I eat a very balanced diet, and I take my vitamins and I meet my protein goals most of the time. And so my doctor recommended that I increase my protein to 80 to 100 milligrams a day. Before it was 60 to 80 milligrams. So that was his recommendation. It wasn't awfully low. It was 15. And like I said, the range was 17 to 34. Low prealbumin can also mean a whole host of other things like liver disease and a lot of things that doesn't really make sense for me. So I'm not super concerned, but it was a little scary to think, you know, that this could be having some negative effects on my body. And that is just the reality, you know, that's the reality of it. but overall I feel fine. My iron was low, so they told me to continue taking my iron. I do not take it every day. I have started, since I got these results back, to take it every day. There's iron in my multivitamin, if I'm not mistaken, but I take an additional iron. I also had low B1 and thiamine. And so my doctor recommended I add in a vitamin B50 or a vitamin B100. I picked up a vitamin B100 at Walmart. It tastes bad, but either way, I have been taking that. I really don't know what vitamin B1 controls, but I'm just listening to my doctor. I also didn't look it up. So, and then they also recommended that I get my labs rechecked in 2 months instead of waiting, I think until 9, which is, well, that's where I am now. So I've got to get those rechecked pretty soon. I have a visit coming up, and I'm sure that they will send in labs for me at that time. If not, I'll remind them. So, other than that, which is a big thing, you know, it is a little scary just to think that, I mean, my iron always tends to run low, so that one's not that strange. But it also explains why I'm so cold all the time. But I've lost a lot of weight in a very short amount of time. I've lost 134.2, so almost 135 pounds in the span of 9 months. That is insanely fast, and you just can't think that that's not normal or like typically healthy. So there are going to be some drawbacks to having bariatric surgery for some people, and you know, the benefits still outweigh the risk for me for now. But it's just so vital to take your vitamins, to make sure you're eating a balanced diet, and just, you know, focusing, like prioritizing yourself and your health, and you know, what you put into your body, and you know, it's so important. So, but I did want to share this because I don't hear a lot of other people talking about, you know, their labs or just different things that can happen after bariatric surgery, because it's not all just weight loss and skinny and perfect after you have it. You know, it's a process, and there is a time in where you have to figure out like what your body needs so that it can be, you know, healthy. So that is kind of where I'm at with that. Whenever I do get my labs rechecked, I'll check back in with you guys on that, and you know, hopefully things are up. I've been taking the vitamin B100. I've been, you know, making sure I get enough protein every day and taking my iron and things like that. So we'll see how it goes. Other than that, my diet is still mostly low carb, low sugar, high protein. I'm pretty much eating that way every day, except I do have a little bit of cheatation going on the weekends. Like Saturday and Sunday, I'll kind of just, you know, eat whatever my family eats, or have a treat, or eat out. But I still eat very small quantities, so very small portions, 6 to 8 ounces. And I try to stick to 3 meals a day without a whole lot of snacking. I at least have 1 snack a day, but other than that, I don't eat at night. Like I don't eat after dinner or anything like that. I am still exercising 5 days a week. This week has been a little more challenging than normal. If you've watched any of my other videos, you know that I started running. I started running in December 2022, so about 5 months after 6 months after my surgery. And I had already lost a significant amount of weight, but I started to notice loose skin, and things like that, especially on my arms. So I got a treadmill, and I do that. I run 2 to 3 miles a day on the weekdays, Monday through Friday. And then I also do, just depends, 15 to 30 minute dumbbell exercises. So I do hand weights, and I really enjoy that. However, I ran 3 miles this Monday, and during my run, I started feeling pain in my left knee, which I didn't think that much of. You know, I do a lot of squats and stuff too, so sometimes my knees are a little achy, but never like a concerning pain. So either way, I finished that run, and the next day I noticed that my knee was still hurting. So I ended up I went to Walmart, I bought myself a runner's knee strap. It's basically just a knee strap that goes on. It's pretty thin, like, you know, it just like straps around your knee, and it has like a gel thing on it. And it's supposed to help to stabilize, I guess. And I wore that, and that helped a little bit. I've worn that for the past, today's Thursday, so I wore that Tuesday, Wednesday. Yeah, just 2 days. I'll wear it today too. And that seemed to help a little bit. I also ordered a sleeve off of Amazon, like a knee sleeve. So I'm hoping that helps. My knee still has a little pain. It is better than it was yesterday and the day before though. So I'm hoping that it's, you know, not something major. I'm not thinking it is, just because it started feeling better today. And I'm just gonna focus on my warm-up stretches and cool down, you know, stretches. I'm hoping that that will help kind of warm things up, and so that I'm not hurting myself. I would be absolutely devastated if I had to stop running. So many of my friends or people that I told about my knee were like, Daisha, you are not supposed to run if your knee is hurting, but I literally can't not run. Like, I even feel guilty, and sometimes I'll work out on the weekends if I don't exercise or run specifically. And it's not even about the weight loss anymore. It's not even because of the toning even that I'm trying to do. It's more because I love that feeling. I think if anything, if I've got any kind of transfer addiction, it is not to alcohol or drugs or whatever people get addicted to after bariatric surgery. It is working out. Like, I absolutely love that just high feeling you get after running. It makes me feel so good and so proud to push myself. So I would be absolutely devastated if I couldn't run. So I've got to take care of my knees. I'm going to ask my primary care doctor about it. Maybe I'll have them take a look at it. And just maybe ask like what I can do to prevent injury. I don't want to get injured, but I know that running is very high impact and it can be hard on your joints. So I'm just hoping for the best, because it's like the thing that I've found that if you would have asked me a year ago if I ever thought I would be a runner, my answer would be heck no, yeah, right, like no way. But it just makes me feel so good, you guys. Seriously, I can't even describe it. So transfer addiction, yes, it's real, minus exercise. All right. Also another exciting milestone between month 8 and month 9, I am no longer 200 anything pounds. So I haven't ever shared my weight on here just because I didn't feel like it was vital information, you know, and I didn't want people to compare, like, you know, how much weight I've lost in a certain amount of time compared to them, because we are all different. And you know that someone who weighed 500 pounds is obviously going to lose more weight than someone who started off at 200 pounds. You know, they're going to lose weight faster, and because they have more to lose. And so please do not ever, you know, compare against me or anyone else. It's so easy to do in this community, is to compare, but really you can't. Your journey is yours and yours alone. But I was excited to be in Wonderland, which is what, you know, the community calls it. So I was so excited. I felt like those last like 10 pounds or something, like it took forever. Like I was the longest stretch of time. Like I stalled right before I hit, you know, under 200 pounds. And so that was exciting. I have not been this weight since before I had my son. I had my son 14 years ago. And I think I weighed more than this even when I found out I was pregnant with him. So I am just really proud of myself. I'm loving shopping and clothes and feeling good in my skin, being able to shop wherever I want. I mean, if you've watched my other videos, you probably know, and I'm in the same sizes, I think, since my last video, but I'm wear a size large or size 12 pants. And it's so like liberating to be able to shop wherever I want and just choose whatever I want and be comfortable in it, and you know, have clothes that fit me well and not just like what I can find in my size. You know, I have my pick and my choice now. So I think those are the main things I wanted to talk about today. I hope this was helpful for you. I hope you enjoy videos like these. If you do, please be sure to give them a big thumbs up and follow me over on Instagram at Lux Plus Life. For some reason, my camera cut off earlier, but either way, thank you guys so much for watching. I really do appreciate your support, and I will see you in month 10. If you have any requests, questions, or anything like that, be sure to leave them below. Bye, guys.